Hello, my name is Dr. Amy Knowles, and I am the Assistant Dean, your Assistant Dean for Student Affairs and Admissions at the NYU Rory Myers College of Nursing. I am so honored and pleased to welcome all of you, our new and continuing students, to the NYU Rory Myers College of Nursing Clinical Sequence Virtual Welcome Event. It is now my honor to introduce to you the director of the undergraduate program, Dr. Larry Slater.
Hello, my name is Dr. Larry Slater, and I am the Director of Undergraduate Programs at the NYU Rory Myers College of Nursing. It is my pleasure to welcome all of you to the NYU Rory Myers College of Nursing Clinical Sequence Virtual Welcome Event. This event is to introduce our baccalaureate students, both new and continuing, to the core nursing clinical and course components of your education. We are excited for you to start this journey and are so encouraged by your enthusiasm for your future nursing profession. We look to you as our future nurse leaders who will lead with compassion and humanism in your chosen nursing practice, demonstrating exceptional critical and clinical thinking, which you will build over the course of your next 4 semesters with us. We know today will be the beginning of an exceptional nursing journey for you, starting with your Myers education, guided by our outstanding faculty. At this time, I would like to play a brief video introducing you to nursing at NYU Myers.
I've always been interested in medicine my whole life, and I do have a passion for helping people, so I just thought that nursing kind of combined both of those passions.
I chose NYU because it's a great school and it's located in Manhattan.
So our clinical placements are all throughout the city in different boroughs, and we see a patient population that's so diverse.
Diving into different clinicals where it's more specific to the different specialties for like pediatrics, maternity, psychiatric nursing.
What sets NYU Myers apart is that we have a state-of-the-art simulation center.
The Simulation Center provides the most lifelike experience next to dealing with an actual patient. The mannequin has vital signs, the heart beats, you hear breath sounds, it breathes on its own, you can see its chest rise and fall, and it just provides a simulation unlike any other.
We want to prepare people with the best technology before you even walk in to see a patient.
Our undergraduate students are exposed to research early on in their program.
From their first semester of their first year of undergraduate experience, all the way through PhD students and postdocs.
So the faculty always makes themselves available to students, and they're also very involved in some of the student organizations and groups.
And it really helps, and it's comforting to know that I could lean on a member of the faculty if I had any questions regarding my schoolwork.
NYU Myers prepares students for the real world of nursing through our diverse clinical sites, which gives them a well-rounded approach to nursing.
If I had a friend that wanted to know what was unique about Myers, everything is unique about this school.
Students love to learn, faculty love to teach, and then the hospitals and home care agencies love to get our students because they're so well prepared when they get there.
Since I've been at Myers, it's actually instilled a lot of pride in me. I want to get out there and I want to be a successful nurse because I know that not only would I be making myself proud, I'd be making the instructors that guided me proud.
Every day I'm at NYU Myers, it just makes me more excited to become a nurse.
We hope you are inspired to hit the ground running as you start classes and clinical. On your journey, remember that your faculty, staff, and administrators, as well as your fellow students, are here to help you every step of the way. Again, welcome to NYU Myers and to your nursing future. It is now my honor to introduce to you the Dean of NYU Myers and Erlene Perkins McGriff Professor, Dean Eileen Sullivan Marks.
Hello, everyone. Today we recognize the significance of compassion in healthcare and welcome our new baccalaureate students and welcome back our continuing students entering their clinical sequence coursework. Our baccalaureate students entering their first clinical sequence course work this semester will receive an NYU Rory Myers College of Nursing coin, a symbol of the strength of our nursing education. The coin on one side identifies us as members of NYU and the Rory Myers College of Nursing. Let me tell you something about Rory Myers and the naming gift from her husband and family that supports nursing scholarships at NYU Myers. Rory, who is currently ill with a debilitating disease, is a nurse. Her sons and husband wanted to honor her by naming NYU College of Nursing as the Rory Myers College of Nursing with a gift of $30 million that largely goes for nursing scholarships for undergraduate students and for research. This gift is in perpetuity. So well into the future, nurses will be receiving scholarships to attend NYU. On the reverse side of the coin, it states a motto: nurses, leaders for today and tomorrow. That is you. Starting today, whether you are entering your first semester in our nursing school or your first clinical sequence caring for people, you have already reached a goal, and we recognize that it has been a challenge to get to this point, particularly in 2020. These coins, often called challenge coins, have a tradition among units in the military, first responders, and other units that see themselves with a unified purpose and mission. We at NYU Myers are just such a unit, and you all today are embarking on this next phase of your nursing professional career. I wanted you to have these coins as a reminder, because I began my first semester as a nursing student maybe 5 decades ago now. Then we wore caps, we had distinctive uniforms to proudly identify our unity. While you do have violet scrubs and ultimately will receive the traditional NYU Myers nursing pin to wear as a registered nurse, like here, before you graduate, we feel that at this clinical juncture, it's important to mark your transition to this phase with the coin that you will receive in the near future. Display it, carry it, show it off, put it on your bookshelves, but remind yourself of all that you have accomplished in excellence to this point, and that you will continue to persevere in the spirit of NYU's motto, per stare et praestare, to persevere and to excel. As new clinical sequence nursing students, you will also receive a pin from the Arnold P. Gold Foundation. The pin represents compassion that you must have and already do have. The Arnold P. Gold Foundation supports schools and colleges of nursing with ceremonies designed to inspire a commitment to humanism and providing compassionate, patient-centered care among students entering the nursing profession. Nurses certainly have shown evidence of this in New York City and elsewhere during the pandemic. The Arnold P. Gold Foundation is an international not-for-profit organization that infuses the human connection into healthcare. Founded in 1988 with strong roots in medical education, the Gold Foundation has expanded its work to include nurses and healthcare executives and to help tackle systems-level change. A statement by Dr. Richard Levin, President and CEO of the Arnold P. Gold Foundation and an NYU alum, on ceremonies similar to this clinical sequence virtual welcome event, he states, quote, "We hope this coin, this iconic ritual, will provide future nurses with a touch point of humanism that they can reflect on and rely on as they face the inevitable challenges and joys of caring for patients with compassion." End quote. At this time, I would like to thank Dr. Elizabeth Cleek of the Arnold P. Gold Foundation. We thank Dr. Kleek and the Foundation for their support of our clinical sequence welcome. I would also like to thank our incredible nursing faculty who teach in the undergraduate program. We thank them for their education to excellence and perseverance in nursing education, particularly evident this year during the pandemic. And I know their dedication will continue well into the academic 2021 year. In addition, I would like to thank our administration and staff for supporting our students during their time with us. I also would now like to introduce Dr. Dorothy Houlihan, the May 2019 recipient of the NYU Rory Myers College of Nursing Dean's Distinguished Teaching Award and the 2020 recipient of the NYU Distinguished Teaching Award. Let me tell you a little of Dr. Houlihan. For almost 40 years of nursing experience, she has advanced to practice in oncology, pain management, and palliative care. She has been a pioneer in this area. Dr. Houlihan's clinical practice is as a nurse practitioner with the palliative care team, which she established at the J.J. Peters VA Medical Center in the Bronx. And she's an associate professor and now professor and director of the Palliative Care Nurse Practitioner Specialty Program at NYU Myers College of Nursing. She holds national board certification as a primary care nurse practitioner, geriatric nurse practitioner, and advanced practice hospice and palliative care nurse. She has been named a national fellow in palliative nursing and is a fellow in the American Academy of Nursing. She has written numerous publication and book chapters and has taught nurses across the nation and in countries as far away as Singapore, the Philippines, and Kenya. Dr. Houlihan has been teaching at NYU since 2002 and has taught courses and guest lectures to all levels of nursing students here at Myers. She is someone who cares deeply about her patients and deeply about her students. I invite Dr. Houlihan to speak to you at this time.
Hello, everyone. My name is Dorothy Houlihan, and I'm a professor here at NYU Myers. And I want to add my congratulations to you all at reaching this incredibly exciting time as you're going to be starting your clinical sequences. I put together a few simple slides that I'm going to pull up now so that we can have some pictures to go along with my remarks. So you've been working hard, and now you're heading into a new experience where you're going to continue to work hard. You're going to be in the simulation lab more as you learn more and more how to take care of patients and all those technical skills that are necessary to do so. And then you'll be sent out into the hospital floors to take care of real patients with real problems. Before you head out, I want to remind you a little bit of one important skill that you may not have thought about that much, but really is probably the most important skill you're going to bring to patient care. And that's compassion. And you're going to say, oh yeah, that's very touchy-feely, but I want to talk about that and apply it to some situations where you can see how important it is. So what is compassion? Compassion is when you recognize suffering in another person, and then you develop an action to meet that. So it's a compassionate person acting to relieve suffering. And so I want you to be mindful of this nursing skill as you go into your clinical work. When you're probably focusing quite a lot on technical skills, I want you to keep the skill of compassion in the back of your mind. And let me tell you a story about my own beginning career to try to help make this make more sense. I remember my first day in clinical practice, and I'm not a little fuzzy on when it was in school, but I certainly remember that very first day when I went to work as an RN. I had taken a job on a general surgery unit at Columbia Presbyterian, big, scary hospital for a country girl. And I was all ready to go to my first day of work. I set out my nice white uniform and my new shiny name tag, and I went to bed, lying there thinking, I think I've got this covered. I think I have the basics of the nursing process down. I think I can manage an IV pump. I passed my med test on orientation. I'm going to be okay. And as I was falling asleep, I was thinking that there's probably one skill that I really hadn't really mastered that might be important on a surgical floor, and that was putting together wall suction. Now, some of you may not be familiar, but on a surgery floor, people have a lot of drains from their surgical incisions and their wounds, and they sometimes need to be connected to suction, which is, just attached to the wall, the suction machine. And I was a little confused about how to put together all those tubes. And as I fell asleep, I had this terrible nightmare that I just couldn't figure it out. And people were yelling at me, get the suction, hook up the suction. And I was running up and down the hallways trying to figure out how to do this. And I got locked into a utility room where hundreds of buckets of suction machines were falling on my head. It was a nightmare. To say the least, a clinical nightmare. So I woke up the next morning, I pulled myself together and I went off to work, and I met then the preceptor, the nurse who was assigned to be my buddy in the clinical setting. And I still remember her to this day. And she said, we were walking down the hall and chatting, and she was asking me about myself. And what do you feel good about, Dorothy? What do you think you need to work on? And I answered her truthfully. And then I said, but I think there's maybe one thing that I don't know much about. And it's wall suction. And I don't know what I must have looked like, but she turned to me and she said, come over here and sit down for a minute. And she said to me, I know this is a difficult time for you, but we're going to get through this together, and you're going to be comfortable and successful in the end. And I'm going to be there with you the whole way. And to this day, I don't remember the basic, all of the complexities of wall suction. I'm a doctorally prepared nurse practitioner, and if I have to figure out wall suction, I'll ask somebody who works with it every day to help me. So the wall suction part was not the important skill there, was it, that I learned that day? It was compassion. It was this nurse seeing in me suffering and then acting upon it to relieve that suffering. And indeed she did. And I remember her to this day, and I'm not even going to tell you how many years ago that was. So I want you to know that as you go on, keep this skill of compassion, this underlying acceptance of what the patient's personal experience is as you go through, because truly, if you lack compassion, all of those other skills are really not going to be as important or matter as much to where the patient is sitting. There was a quote that's been attributed to many different people over the years that says, no one cares how much you know until they know how much you care. And truly, nurses do this every day. They think and recognize where their patients are coming from, where they're suffering, and they act to relieve that. And so remember, keep the compassion mindfully in the forefront of your mind as you go about your clinical duties, and you will be successful. I would be remiss, I must say, to not remind you that we have to be compassionate to ourselves, that we have to take care of ourselves as well if we're going to be able to take care of other people. I remember back when I was in school, I had a nursing professor who used to say to us that being a nurse is like being a well. And every day you go to take care of patients, you're giving of yourself. You're drawing water from that well, and you need to develop a way to keep your well filled. So ask yourself, how do I fill my well? Now, if you haven't consciously considered this before, I want you to do so now. Is it yoga? Is it music? Is it cooking? Is it your kids? Maybe it's faith practices, maybe meditation. Or maybe it's just having that one friend who can listen well. Or maybe a couple of friends who listen well. Or maybe a bunch of friends who listen well. Oh, but these friends are not very socially distant, are they? Maybe what you need is a friend like this who will listen well over Zoom. I know I went overboard on the animal pictures, but I just wanted to make this point that on the days when you're anxious, when you're worried, when you're overwhelmed, remember how to feel that well. And remember why you chose this path of nursing to begin with. Because I think if you think about it, and every time you think about it, it's because you want to meld technical skills in the healthcare arena with a sense of compassion for other human beings. And if you can keep those two nursing skills integrated in your practice and compassion at the forefront, you are going to make absolutely awesome and outstanding nurses. And I'm going to be so proud to call you my colleagues. Thanks very much for your time. Good luck. We'll see you around.
Thank you, Dr. Houlihan. What an inspiring message. At this time, I would like to introduce to you the president of the Undergraduate Nursing Student Organization, senior student, Hannah Moses.
Hello, everyone. It is an honor to be here and speak with you all. My name is Hannah Moses, and I am the Undergraduate Nursing Student Organization, or UNSO, president. I want to congratulate you all on behalf of the nursing student leaders as you embark on your clinical sequences. This is where you'll learn to integrate the science, theory, and essence of nursing through panels of working nurses during professional nursing and concept maps during pathophysiology. The 12-week shortened semesters are going to go by in a blur, and before you know it, you'll be rattling off medication names, classes, mechanisms of action, and nursing indications from pharmacology, and doing full head-to-toe assessments on each other using skills you learn from health assessment and promotion. The clinical coursework component is important to connect the textbook learning to the actual nursing practice. We are so fortunate at NYU to have unparalleled learning environment centered around such a diverse patient population with excellent hospital systems. For your adult and elder classes, you will have off-campus clinicals at the NYU Langone Health System, and for specialized courses, including psych, maternity, or peds, you may be placed at Mount Sinai or New York Presbyterian, just to name a few. During the other weeks, you will be practicing and learning new skills during on-campus clinicals in the Clinical Simulation Learning Center at the Myers Building. I encourage you to soak in as much as you can during your sequences and go in with an open mind. Observe the nurses that you work with, interact with the patients, and apply your knowledge in the clinical setting. You are in charge of your education, and I invite you all to take advantage of the practicing nursing and care for patients with compassion. There will be early mornings, and it will be challenging, but the experience from the clinical sequences is so exciting and rewarding. Again, congratulations, and enjoy your transition to the clinical sequence courses.
Thank you, Hannah. Thank you all for joining our NYU Rory Myers College of Nursing Clinical Sequence Virtual Welcome. And I wish you all a successful semester, one that will be challenging, but will be rewarding. And I know that your clinical experiences will enrich your career. You will take the memories and the experience from this semester forward for the rest of your career. We are proud of you and are excited for you.